As Arizona's population continues to grow, the number of doctors in the state is falling behind. The University of Arizona's College of Medicine in Phoenix is introducing new initiatives to address the state's doctor shortage. Dr. Frederick Edward Wondesford is the Dean of the University of Arizona's College of Medicine in Phoenix. He joins us right now. Dean, good to have you here. Thanks for joining us.
Thank you for inviting me.
You betcha. All right. We've talked about this over the years here. We got a teacher shortage and we got a doctor shortage. It never seems to change for doctors. Why is that?
It takes a long time to train to be a doctor. So that's part of it. When you have a doctor shortage, you're talking about a 10-year window, what it's going to take to get people out in practice. So we were short of physicians in 2010, and of course with the population growth, we're even shorter on physicians today.
The population growth, how big a factor is that?
It's a significant factor in the number of physicians that we're down. It was estimated we would be 50% less physicians than when we need by 2030. Some estimates as high as 70% less primary care physicians than we need by the same time.
And more than 1 in 4, the recent study, more than 1 in 4 Arizona adults do not even have a personal doctor.
Yeah. Yeah, and the primary care physician is the first person that you meet in medicine. Sometimes the only person you meet. They get you plugged in for preventive care, and then they refer you to a specialist when you need, additional care.
And the issue, I would imagine, will be much worse in rural areas.
Definitely worse, and particularly in Arizona, with a lot of rural areas that have a very high what the CDC calls the social vulnerability index. So if you have a 1 on that, you're the most vulnerable. We have several communities in the periphery of our state that have very high social vulnerability.
Yeah. All right. So, UA College of Medicine Phoenix working with. Are you working with Banner on this? What are you talking about?
We are. So, to mint a new doctor, we need a medical school, but we also need the training after medical school, what is referred to as a residency. Some people call it graduate medical education. To become a doctor, a licensed physician, you need to have both. You've got to have an MD, but you also have practical experience from a residency to get your license in a state. So Banner is providing a number of new positions, graduate medical education positions, which we need. And of course, we need the students to graduate to fill those positions.
So when you say that these are new positions and a number of new programs here, expanding the medical education program, the graduate, why wasn't that done before? I mean, what has changed?
The evolution of healthcare in our state. I think it's been helpful that there's a medical school in Phoenix associated with Banner. I think there's a virtuous cycle. So if we make students, we graduate students, they need training. Banner needs practicing physicians. Mm-hmm. Banner then agrees to fund additional training positions to have those physicians.
And we're talking primary care training for the most part?
Not all primary care, but mostly primary care. So that would be family medicine, general internal medicine, general pediatrics would be primary care.
Correct me if I'm wrong here, but it sounds like some of these are pretty fast track to the point where you can graduate maybe a year early?
Correct. So that is the new program that the Arizona Board of Regents approved, and also our accrediting body called LCME approved. And that allows you to graduate in 3 years. Our program in particular, though, that graduate is going to go into primary care and not into specialty care. So that's where the accelerated track would be.
So you start your residency faster, you start your practice faster,
Correct.
And you get some of those numbers up.
Yes, and the other thing that's novel, that's really important here, is that the primary care track, there's a linkage. So you go into a residency perhaps in the location where you did your medical student training, and you stay in that location. And the studies show the longer you train in a location, the more likely you are to stay in a location.
Are there incentives to stay in that location?
In some cases there are, but really in our case, the tuition will be a free tuition for our 3-year program. So that'll be the first incentive. And the second incentive will be you're going to graduate a year earlier.
I was going to say, if you graduate a year earlier, that sounds like less in the way of debt, but if it's free, Holy smokes, there is no debt.
Well, this is tuition, right? There's always room and board and other fees,
okay.
right? But still, 1 year less, the tuition debt is going to be less.
Scholarships involved here?
There'll be scholarships.
Okay.
There'll be full scholarships for this training.
Is there collaboration? Obviously, UA and Banner working together on this. What about other health organizations, entities here in the Valley and around the state? Is there more collaboration on this to get this situation fixed?
I think there's definitely collaboration. Obviously, ASU is in the middle of getting their medical school accredited. That's going to be a source of graduates. NAU is interested in forming a medical school. That would be another source of graduates. But probably medical students are one thing, but we need more graduate medical training, the residency positions that we talk about too, because it's a continuum.
And the state needs to be more attractive in getting doctors to come out here.
Yes, but of course, if they train here, they're more likely to stay here. So,
Yes.
and it's much easier to retain somebody than recruit them here.
Okay, last question real quickly.
course.
I asked our weather guy if he was optimistic. I got a kind of one of these sort of things. Are you optimistic about the doctor shortage?
Very optimistic that we can have a solution toward it. And I think because there are these innovative programs, and we have the universities and as well as our regents behind a program to really expand medical education here.
All right, Dr. Fred Wundesford, UA College of Medicine in Phoenix. Thank you, sir. Appreciate it.
You're welcome. Thank you.